Yossi, before we start,
Yes.
what we're going to do is introduce the guests that are here right now, so to make sure that they understand what this program is and what we have been doing for the past 8 years in the Ural Mountains. Okay?
It's a big pleasure for us.
Okay,
Please.
on my right, maybe your left, this is Laurie Moser. Laurie is a friend of Sandy and I. She's very involved in our Jewish community, and I'm sure she is here to try and understand what this program we've been doing, and I'm going to explain. And we have Sue Linzer, who you know. Sue has been,
Yes.
I believe you've been to Ekaterinburg, and Sue has worked with us on this program, I think, the entire time we have had the program.
You remember our, Sue, you remember our trip to Tumen?
I sure do.
Yes,
Sure
yes.
do. Donate to where? To me.
Just a few words for Laurie. Laurie, Sandy and I, with the help of Michael Steiner and the Federation, without going into all the details, started an SOS, an emergency fund for the Jewish people who have certain types of emergencies in the Ural Mountains, where they have approximately 40,000 Jewish people in an area, I think, that encompasses almost the size of the country of France, if you look at the entire Ural Mountain area. And we also do this program in Moscow, where we have a different person who is involved with it, but we have combined them both. And what the purpose is, in Russia, unlike perhaps the United States, there are lots of people who have issues, older people, some of them younger people, medical issues, issues of trying to survive and have payments, but they live on very meager pensions. And we came up with this program, which we were able to help these people by making not grants, but by making just, by actually making grants that were not loans to be paid back for many diverse things. It started out in one thing with home repairs and things they couldn't have. Today, because of the situation in Russia, a lot of what we do is based upon medical needs that they can't get for themselves. And Yossi, who has been our head, what they call Netzi in the joint for JDC, has been heading up this program with his unbelievable committee of people. In fact, I feel like I know them. We've been there many times and had to meet them. But what we're going to do today is discuss a few cases to approve or not approve the monies that are being spent, and just have an opportunity to be able to hear what they have to say.
Generally, we have nothing to do with the approval of money. The committees do it.
But today, right, that is part of what we do, but they do this without us. We also have someone else who has come in, Ellen Friedman.
Hi.
Is from our community. Ellen, I don't know, have you sat in on these before? I think you did sit in on one. And Ellen, where are you? Where are you from originally, Ellen?
I'm from Odessa.
She is from Odessa. So she's now a very, very accomplished lawyer in the city of Pittsburgh, and we're happy to have her be part of this discussion that we're having today.
Okay.
That's all I have to say. Now you can introduce our people.
I want to...
We follow the agenda. The first part is one case, also a professional introduction by a doctor from Ekaterinburg, and now we're going to their session, and Yossi is taking over. Yossi, go ahead.
I want to introduce to you Larissa Glusman. It's JDC Regional SOS Coordinator in our area. Beautiful staff member. She will speak in Russian and will translate. Please, Larissa, пожалуйста.
Дорогие Сэнди, Эдгар, Майкл и наши новые друзья, которых мы видим первый раз, мы вас здесь приветствуем.
Dear Sandy, Edgar, Michael, and our new friends who we see for the first time, we want to greet you here.
И хотим спросить, как вы себя сегодня чувствуете, как у вас здоровье?
and want to ask you, how do you feel? How you are doing today? What is your health like today?
Good.
Wow.
Our health is very fine. Sandy and I feel very good. Without going to any discussion, Sandy and I just returned from Haiti where they had the earthquake last week. So we're very happy to be back here in Pittsburgh.
У нас сегодня здесь 3 врача присутствуют, и наша комиссия сегодня больше похожа на врачебный консилиум.
Today we have here 3 medical doctors who are with us today, and our committee looks more like a doctor concilium.
Я скажу немного цифр, почему это происходит.
I will give you some figures why it is taking place.
Из фонда, который вы представляете, Урал в этом году получил 62 300 долларов.
Out of the foundation headed by you, the Urals committee has got this year $62,300.
И за это время, вот по июль включительно, больше чем 60% этих денег израсходовано уже на помощь людям, которые оказались в тяжелых ситуациях.
And during this year, up till July, inclusively, more than 60% of this money has been already spent for aid, for help to people who found themselves in difficult situations.
Почти половина этих случаев медицинские. Это лекарства, это операции, онкологические, операции на глазах, кардиологические.
More than 50% of these cases are medical cases. These are oncology, surgeries, side problems, all kind of operations, and so on.
Это медицинские обследования, и это то, что во всем мире, не только на Урале, дорого, зубопротезирование.
Medical inspections, investigations, and teeth prosthetics, which is quite expensive over the world, not only in the Urals.
Именно поэтому у нас сегодня врачи, именно поэтому те случаи, которые мы будем разбирать и которые обсуждать, это медицинские случаи.
That's why we are having here medical doctors, and the cases we are going to discuss today are medical cases.
Но прежде чем мы будем говорить об этих случаях, хочется немного информации дать о том, как на Урале обстоит ситуация с медициной.
But before we start discussing these cases, I would like to give you some information about the situation with medical care in the Urals.
Я хочу представить специалиста, врача-кардиолога, преподавателя медицинской академии, кандидата медицинских наук и при этом очаровательную женщину Елену Футерман.
And I would like to introduce to you Елена Futterman, who is a medical doctor, the PhD, the professor at the Medical Academy, and a practicing cardiologist.
Please.
Good evening, Sandy and Edgar. Good evening, Sandy and Edgar. I am very glad to meet you. We all Jewish doctors are Hesed volunteers, and I'd like to help you to learn more about the situation with medical care and health conditions in our region. The situation with health in Ural region can be characterized by negative changes. On the one hand, there are natural decrease of population because of low birth rate and high death rate. For instance, last year the number of death was by 7,000 more than the newborn. As to young and middle-aged people, the main cause of death is injury and poisoning. Cardiovascular disease and oncology takes the second place. As to elderly persons, cardiovascular disease ranks the first and oncology takes the second place. On the other hand, aging of population and decrease of life expectancy are observed. In Sverdlovskaya Oblast, the average life expectancy for women is 71, and for men only 57 years. The living standards and quality of life is descending because of increase of mobility and disability. There are many reasons for that. Financing of public health is inadequate. At the same time, the medicine and medical equipment are going up in price, and expensive modern medical technologies are appearing. I know from my own experience that patients scheduled for coronary revascularization, surgery on coronary artery procedures, have to wait from 3 to 20 months, and part of these patients will have myocardial infarction. Usually, only able-bodied are taken to cardiologist hospital with modern equipment. System of state insurance medicine is inadequate, so patients have to pay for medicine themselves. Thus, high-qualified medical care is not available for most of people with low income. For instance, oncologist patient has to receive medicine for chemotherapy strictly on the schedule, but often medicine are dispensed later than planned, and original drugs are replaced by generic drugs. So, efficiency of treatment is worsening. Modern surgical technology is not available too. About 2,000 patients are scheduled for endoprosthetics replacement. High level of oncology morbidity and mortality can be explained by bad ecological situation. The natural radioactive substances, for example, uranium, radon, and heavy metals are located in the soil of the Urals, and people use these materials from this place for construction and agriculture. Our region is the 6th in Russia and the 2nd in the Urals in the level of pollution of the environment. In Chelyabinskaya Oblast, the large industrial complex processes radioactive wastes from the whole Russia and about. There was big explosion in this complex in 1957, and as a result, large part of Ural region were radioactive contaminated. There are many ecological dangerous plants in the Ural region, which use out-of-date equipment which pollute the environment. About 3 million people in our region are provided with water not meeting the norms. The main rivers of region are among the most polluted water options. Last year,
Они Иванти, им это берет
Okay.
יותר בכל
last year,
Hold on for 1 second. יוסי, יש לנו הפרעות קשות, אנחנו לא מבינים.
Last year, more than a half of deaths in our region were caused by cardiovascular disease. The cardiovascular morbidity has doubled than compared to 10 years ago. It can be explained by low physical activity, obesity, and high level of stress because of economic instability, rise of unemployment, and decrease of income, and constant negative information from mass media. The number of diabetes cases has increased, and it causes the cardiovascular complication. The high level of injuries and poisoning are connected with alcoholic and drug addiction. In the Urals, about 500,000 people suffer from alcoholism, and about 80,000 are drug addicted. Taking into account the difficult situation in the Ural region, your help is vitally important, and we appreciate your care and comparison. Thank you. If you have any questions, you are welcome.
My God, very good. Bravo. Your English is superb.
Thank you.
It's superb.
Thank you very much.
Thank you for the information.
If you have not questions, we will continue with first case for our SOS committee.
Yes, but we are only, let's stop using the other microphones. Only use the microphone
секунду.
on Snyder.
I'm under.
Close the other microphone.
Секунду, Петя, принесите сюда этот
Okay,
микрофон.
sure.
We're done. Now we only with one microphone.
Сейчас мы начнем работу нашей комиссии, и вы увидите давнюю вашу знакомую, хорошего друга, Татьяну Галееву, это директор ХЭСа в Оренбурге. И вот первый случай от нее.
Sandy, and hello Edgar, Michael, and all our new friends. How do you feel yourself? How are you there?
We are wonderful. It's good to see your pretty face again.
I'm very glad to see you also. So,
He had 39 Fahrenheit last night.
They had what?
39 Fahrenheit last night.
Really?
39 Fahrenheit. Already in fall.
Микрофон, вы можете спокойно, только громче.
do you hear me well now? Do you hear
We're
me well
fine.
now?
Fine.
Oh,
It's
no,
okay.
No,
Они
you're
не
too close.
слышат.
Too close.
Во-первых, Татьяна,
Okay, is it
громче.
okay now?
Yes.
That's good. So, I would like to pay your attention to the situation from Orenburg region. One man, his name is Remy. He was born in Belarus, and as a child, his family then moved to the Orenburg region, the city of Orsk of the former Soviet Union. He studied at secondary school, and after finishing school, he started to work at a factory as a turner on a lathe machine. After serving in the army, he was subsequently discharged and went on to work at tractor manufacturer. So then in 1995, he became progressively ill with the atherosclerosis of the feet. And as a result of this illness, he was classed to the second disability group. Then in 2003, his atherosclerosis transformed to gangrenous infection, and his legs had to be amputated, classing him to the first group disabled. Then in 2010, this year, our organization funded the surgery for finger amputation and for laboratory x-rays and medical analysis. And in addition to all these medical complications, this man was diagnosed as diabetes mellitus, and in this